why people feel they're staying muted is that we collectively agreed that given a whole lot of, I guess the term Zoom bombing, because everybody's living in Zoom wonderland, Zoom bombing has been going on, and there have been some incidents around racist incidents and other things as well. So we decided to, for the host and my co-host Shakir, that we will we will control. We don't want to police anybody or anything, but to at least have this control on mute and unmute, and also about screen sharing. So it'll be just for the host. And in a sense, if we'll be going through this this evening, we have two guest speakers as well who will talk to us about the expansion of police powers and all that, and we'll get to the introduction in a second, but just want to talk about some logistics. The chat room is there, and if somebody has a question, please send us a message, and or if you're on the phone, and if you're not on the computer, you can always text us. Like, you know, we can always unmute you, and the text is 562-230-4578. Again, 562-230-4578. So you can text us or send us a message in text room, or there's a raise your hand function in there as well. And we'll be going through a presentation for the next about 40 minutes or so, and then we will open it up. We will also attempt at some point, if people are shy and nobody wants to be unmuted, we may just unmute everybody. But just to be a caution there, that because people think we're still muted, there's a tendency that there's a whole lot of background noise in back there as well, and we'll let folks know. So we're gonna get started. Shakir, you wanna say a few words or?
No, yeah, I have nothing to add other than, yeah, just what the point about if you have a question or a comment, you don't you can type the whole thing in the chat, but or you can just type question, comment, or unmute me, and we'll just unmute you and you can chime in.
Excellent. And we're also recording this session as well, because there's been a lot of requests from a lot of folks from around the country to share that. So we'll be doing this. And then, so we're going to get started. I want to welcome and thank our guests, Andrea Ritchie and Kath Rogers, who have taken the time to be a part of this conversation. And maybe we'll just ask them to quickly introduce themselves. Andrea, you want to go first?
Sure. My name's Andrea Ritchie. I'm coming to you live from Brooklyn. I co-founded the Interrupting Criminalization Initiative with Mariam Kaba here in New York, and joined by Woods Irvin, who many of you may know, and also provide technical assistance to organizations around the country working on policing and criminalization issues through the Borealis Communities Transforming Policing Fund, and I'm a member of the Movement for Black Lives Policy Table and general agitator, organizer around policing issues. Thanks for having me, Hamid.
And an awesome writer.
Yeah, thanks.
And our next guest is Kath Rogers. Kath, do you want to introduce yourself?
Sure. Hi, Hamid, and thanks for hosting. And hi, everyone. My name is Kath Rogers. I'm the executive director of the National Lawyers Guild of Los Angeles, and my pronouns are she, her, hers. The National Lawyers Guild, we're part of a mass defense network. We help communities to protect their own rights. We monitor law enforcement violations of civil rights, especially in the context of progressive protesters. Just last year in Los Angeles, we were out at 150 demonstrations throughout the county. So this gives us kind of like a macro level view of how law enforcement is responding to resistance activities. And we're an abolitionist organization. We're anti-capitalist, anti-imperialist, and we're happy to be in the fight with all of you.
Thank you. So with that, Kath, might as well just dive right in. And I know you have a presentation. So let me just open that up. Oh, there you go. There's a slideshow, and there you go. Okay, Kath, it's all yours.
Okay, great. And Hamid, I'll just let you know when it's time to switch slides.
Please.
So thanks for doing that. So I'm going to talk a little bit about just the expansion of government policies and police practices in times of quote unquote emergency, real or concocted. My talk is going to be limited to US legal frameworks. I think some of my esteemed co-panelists are going to speak to some international responses. Next slide. So here's an overview of what I'm going to go over. I'm going to talk a little bit about just some of the legal frameworks in history. First, I'll talk about some informal emergency powers that have been exercised throughout history. Then I'll talk about the formal state of emergency declaration, and then I'll talk about martial law. And then we'll look at the present, and we'll talk about the current federal, state, and local measures that have already been passed relating to COVID-19, and we'll talk a little bit about what your rights are under those measures. And then we'll look forward, and that's just kind of a question I want to open up to the group, which is just how in this moment, which is frightening and scary and very difficult for many of us, how do we use this moment to create the world that we want to see? Next slide. So first I want to start with what I've called informal emergency power. There's long been deference to the executive during times of real or stated or perceived emergencies. We know that the Constitution gives powers to the executive, the legislative branch, and the courts, but in times of emergency, that has not been the case. Nowhere in the Constitution is there an explicit authorization that the executive should have these additional powers in times of emergency, but some scholars think that the framers kind of implied these powers, that because the stated justification is that because the executive branch is able to act faster than the legislative branch, that the executive is more adept at reacting quickly to emergencies. But regardless of the justification, it's been used, whether or not the courts or Congress approves of that. These are just three examples in history, only three, but when Lincoln during the Civil War suspended habeas corpus, which I describe habeas corpus as basically if you're a criminal defendant, if you're accused of a crime, it's your right to have your day in court. He suspended that during the Civil War, and his justification was that the rebellion by the South justified him doing that. The court disagreed and he went ahead with it anyway. FDR tragically invoked his emergency powers during World War II, or I'm sorry, FDR interned all of the West Coast Japanese Americans during World War II using emergency powers. And this was upheld by the courts in the really infamous decision Korematsu that's still precedent to this day. And then another example is when Truman attempted to nationalize steel mills, meaning have the government take over private control of private enterprise and break up a worker strike in 1952. This action was actually stopped by the courts though. And so that's an interesting example of courts stepping in to protect private property rights of these mill owners, corporate owners, rather than in Korematsu where they refused to do so to protect the rights of Japanese Americans. The rationale was the same in both cases, national security during wartime, but the outcomes were different. And so this is just one example of kind of the property rights versus human rights framework that we see again and again. Next slide. So now I want to talk about the formal kind of state of emergency. So what I was talking about before is the implied or the informal state of emergency. This is where a state of emergency is actually formally approved by statute. So at the federal level, there's a 1976 law, the National Emergency Act, and that's only one of a number of federal laws that authorize extended emergency powers of the president during a state of emergency. Again, it's the same rationale that the executive can act quickly. It drastically boosts the executive's power. There's over 130 powers that are at the disposal of the president during a state of emergency. And they include almost every aspect of life, whether it's, military, land use, agriculture. There's one particularly scary one that allows for chemical or biological weapons testing on humans. The state of emergency is declared by the president, and states also have this too, I should say. It can also be declared by the Health and Human Services Secretary, but at the state level, it would be declared by the governor, and it would only be within the jurisdiction of their state. Local governments can also do this depending on the local rules of whatever municipality it is, whether it's a mayor who can authorize a state of emergency, or a local county board of supervisors, let's say, who can do this. This state of emergency power, it's been referred to as a loaded weapon because it removes basically all democratic checks and balances that typically restrain an executive's power. An example of this was when Trump used this last year to enact his racist agenda at the border. Basically, when Congress refused to approve of his spending on the border wall, he declared a state of emergency, and it is attempting to go at that through the expanded powers of the emergency authorization. Since the 1970s, 60 national emergencies have been declared. The framework is that it's supposed to automatically basically end after a year unless it's renewed. But 30 of these are still ongoing, and presidents continue to renew these over and over again. One example would be President Bush, after 9/11, 3 days after the 9/11 attack, imposed a state of emergency based on that. And that is still ongoing. Every year and every president thereafter have renewed that state of emergency. So it's just kind of, just the word emergency implies that this would be a sparing power, that it would be temporary, and yet kind of the ongoing nature of these purported emergencies allows for this unchecked executive power basically indefinitely. Next slide. Next slide.
Give me 1 second. I don't know. It just it may have gone on pause or resume. Okay. Sorry for that. And okay.
Okay, great. Okay, so the last kind of historic and legal framework I want to talk about is just martial law. Basically, this means that there's military control over normal civilian government, civilian courts, in response to an emergency. So basically, the military takes over what normal government usually does. It's tied to, again, the suspension of habeas corpus, and under the Constitution, the suspension of habeas corpus is only allowed when in cases of rebellion or invasion of public safety may require it. It can be declared by the president again, or by a governor for their state only. And so under military control, some things that the military can do or typically does are things like enact curfews, take supplies, enter areas that it normally can't go, incarcerate people, try them, arrest them, suspend civil rights. So there have been, more than a dozen in US history times when martial law has been declared, sometimes in response to protests. Like in the 1930s, there was a dock workers strike and martial law was declared. In response to the Freedom Riders, in the 1960s, the governor of Alabama declared martial law as a result of, quote, outside agitators coming to Alabama to violate our laws and customs. And to him, that justified declaring martial law. Okay, next slide. So now I want to just jump to the present and talk a little bit about some of the measures that are currently in effect, and we can talk a little bit about the rights under those, and we can talk about that later in the call as well. But starting March 13th, President Trump declared a state of emergency. And so all of those emergency powers that I talked about are currently at his disposal under this state of emergency. Tens of thousands of National Guard troops have already been deployed. And right now they're doing things like helping distribute medical supplies and helping with transport and things like that. But in past emergencies, they've also been used to enforce the law and enforce curfews and other types of laws. And so we'll see if that happens. And it's expected that tens of thousands more National Guard troops will be deployed. There's nearly 500,000 National Guard troops in total. So we'll see how many are deployed in this time. And then I wanted to highlight too, for anyone who's read The Shock Doctrine by Naomi Klein, and just kind of the concept of disaster capitalism, I think that's something to be on the lookout with the federal government right now too. President Trump just appointed his son-in-law, Jared Kushner, as the head of a task force at FEMA that's called the All of Private Sector, which is working hand in glove with private industry and private corporations with no kind of regard for what interests those corporations may have or how this may benefit those corporations at the expense of federal interests. So that's something to track as well. Okay, now moving on to the state, just to highlight different state measures here in California. The state of emergency declaration by Governor Newsom was declared on March 4th, and that directs state agencies to respond. It mandates that residents heed the advice of health officials, and also allows certain patient information related to COVID-19. Usually you wouldn't have your patient information shared, but because that would violate privacy laws, but now under the state of emergency, some of that patient information can be shared. It also allows for state properties to be used for emergency response, things like that. Then a couple weeks later, on March 19th, the California stay-at-home order was enacted, and that was by executive order of the governor. And that orders Californians to stay home except for what are called essential activities, and also exceptions for 16 essential industries, working in those essential industries. And it's a misdemeanor. Violation is punishable by up to $1,000 fine and or 6 months in prison. Right now, statements from the governor are saying things like, we want to avoid criminal punishments. We want to have social pressure and voluntary compliance be, what we prioritize. But this is a state law and it's a misdemeanor, and we don't know how all of our counties are enforcing it. So that's something we need to track, and something that's going to be really important at the local level, that we continue to track arrests and citations for this. Also, some important changes at state prisons. Visitation has been suspended. There have been lockdowns, some pretty scary lockdowns for folks inside. Anytime there are perceived symptoms of COVID-19. The governor has released only 3,500 people inside whose release dates were within 60 days, and also whose offenses were deemed quote unquote nonviolent. And so that's been subject to a lot of criticism for such a low number of people released, and also kind of this like good versus bad rhetoric. And we shouldn't forget too that there are a lot of existing state laws that give extensive discretion to police on the beat. So those could also be used right now. So Penal Code 148 is pretty pervasive. We see it all the time when we're out there, and that makes it a crime to physically resist or obstruct any police or firefighter or EMT. There's also laws against disorderly conduct, failure to obey police orders, nuisance, which is any activity that affects health, safety, or morals of the community. So these kind of laws we may see take effect in greater number under the new kind of normal. Next slide. Okay, so now we're moving on to local measures in LA area. So on March 19th, the mayor put forward the local safer at home order. It's pretty similar to the state one. It's also a misdemeanor. It's also punishable by jail time as well as fines. It does exempt things like, going outside for a walk or driving someplace to go hiking or something like that. So there are certain exemptions for essential activities. For example, the media is exempt. So there's a whole list of essential activities, as well as essential infrastructure workers that are exempt. And so the exemptions are a little bit more spelled out than in the state one, but it's essentially the same. Same thing for the county. There's also a county-wide shelter-in-place order. Another source of potential criminalization is the closure of public spaces. We've seen, I know at least one surfer was in the news for, there was a fine of $1,000 for a surfer who went surfing on a closed beach in contravention to the closure. Also some important court and enforcement changes. So a lot of matters are basically delayed right now due to court closures. So a lot of civil matters, low-level criminal matters are delayed right now. There's a revised bail schedule too. So a lot of offenses that would have had bail set are now set at zero bail. So a lot of people are going to be released on their own recognizance who might not otherwise be. There are exemptions and exceptions to this though. And one that I find particularly concerning is there's an exception for failure to disperse. And so I'm worried that that particular exception could be used against protesters and probably will be used against protesters. Also, there's the rhetoric of law enforcement locally is they're saying that they're going to increase the amount of people who are cited and released versus arrested. So that's kind of on us to continue to track that. LAPD records all of their arrests in an online database that we can all see, and you can just easily Google search it, all LAPD arrest data, and you can see by date, you can see exactly what the charges are. So that's something that we should continue to monitor. Also, there's been a decrease in the jail population. Some folks have been released due to the health crisis. Next slide.
There it goes again. It does one of these things. Okay, there you go.
Okay, thanks. Okay, so now I just want to fast forward to the future, and we are in unprecedented times. This is a scary time, but also a time where we need to really think about resistance tactics, and a lot of the traditional protest and strategies are, sometimes straight up illegal right now or much more difficult to organize. So it's going to be important for us to think about ways that we can fight back against the increased militarization and policing. Also, I think right now, because certain aspects of the economy are kind of at a halt, definitely not all, but some, we're seeing clean air in Los Angeles for the first time that I can remember. How can we use this movement or this moment to kind of move away from private and corporate answers and move more toward public and collective solutions? I think a lot of people are thinking about this and thinking about the lack of social safety nets and the lack of things like right to housing and healthcare and universal basic income. And so I think this is going to be a galvanizing moment where, 6.5 million people just went on unemployment last week. And, these are folks who are upset and, want to fight back. And so I think thinking about ways to build a movement out of this moment is going to be important. So with that as kind of the framing, I don't have, the answers about how we're going to create this world that we want to see, but I think it's an important time for us all to think about that question. And some kind of practical things I put here are, I think it's going to be increasingly important for us to know our rights and to educate others about their rights so that they can stand up for their own rights. And NLG, we have a number of Know Your Rights trainings, and we can always come out and do, well, right now, a lot of our programming is virtual. So if you want to know your rights training, contact me and we can set that up. Also, monitoring law enforcement is going to be increasingly important as law enforcement continues to expand its powers. So programs like Cop Watch, anyone can Cop Watch, narrating what you see, always documenting everything that you see with law enforcement. Things like Public Records Act requests, FOIA and PRA requests, and also just publicly available data, like the data that I was talking about with LAPD, where we can individually go in and track that. Court Watch LA, that's a program I definitely want to plug. There's volunteers who go into courtrooms and watch for, abuses of power. Right now, volunteers are not there in person, but there's a tips line. So if you or anyone you know or love happens to be in criminal court and you see something, messed up, send a tip to Court Watch. You can also follow it on Twitter at Court Watch LA. And then our legal observers. We are legal observing a lot less because of COVID-19. We don't want to deploy legal observers, if there's a risk to their safety, but in emergencies, we do deploy legal observers, and we're doing a lot more remote assistance too. So feel free to call us if we can be helpful in that way too. And the last thing I want to point out is just, folks are developing new forms of resistance and ways to fight back. So something that's been popping up that is a cool new tactic is vehicle protests. I've seen that, especially in the housing justice space, going outside of people's homes, like the mayor, going outside of the Board of Supervisors, and putting banners on cars and honking as kind of like a, health crisis friendly way to protest. More online community building, like this webinar, for example. Mutual aid, where neighbors are getting together in pods to sort of help each other. And Ground Game LA has a really great mutual aid network. NLG is part of it. We are providing some free lawyers to answer people's legal questions, but there's other things that you can do to help, neighbors and others in your community. And yeah, I would just leave it on that question of, what else can we do to movement build in this moment and, band together. So yeah, contact us anytime. And again, we have tons of Know Your Rights trainings and other things. So feel free to reach out if you ever need us.
Great. Thank you, Kath. So I think we'll just, before we move on to a conversation with Andrea, just wanted to see if some folks have any questions. Please, either you could do the hand raising, or if you want to just in the chat room, just send us a quick question. Unfortunately, we are keeping everybody on mute because of all the Zoom bombing that's going on. But anybody has any comments, we can't take too many, because then in about 15-20 minutes we'll have a good over an hour of time for a collective conversation. But any comments on or questions on Kath's presentation? Okay, I guess it looks like people want to hold off. I don't see anybody's hands up. Shakir, do you see anything at all?
No, I don't. And if and if anybody wants to just unmute them, you can just say unmute in the chat, and I'll just
right. And your name will show up as well. And then feel free, if you're on the phone, to text us at 562-230-4578. So feel free to text us as well. All right, so Andrea, just moving right along. Let me just open up the, there it is. And okay.
Is someone's cat purring? That's so awesome.
All right, Andrea, go ahead. It's all yours.
Oh, you can go to the next. You can go to the next slide, Hamid.
Andrea, I think that's the pigeons outside of my house, actually.
Oh, okay. Well, my cat was just here purring, but has disappeared. All right. We've lost, all Zoom decorum at this point. We're all just sharing our entire life with everyone. So just building on what Kath was just laying out for us, I just wanted to add a few other possible enforcement opportunities. So some of this is coming from a call that happened on Tuesday, and I'm just dropping the link to the recording in the chat box now, where, just to kind of back up, I was in Jamaica visiting my family who lives there, who's from there, around the time when the crisis really started to break in North America and in Jamaica. And when I left, there were no cases there. When I got there, there was one. Within a week, there were about 9. And within that time, the government went from immediately closed all the schools, closed down public gatherings, a stay-at-home order, closure of restaurants. All that happened within the space of a week instead of the months it's taken here, and in some jurisdictions it's still progressing toward. But what I also saw during that time was an accelerated enforcement of these public health orders. So it was already a state of emergency there based on violence, and it just accelerated. But also the army was kind of going around and picking people up who were on planes with people who had tested positive. They were enforcing quarantine in an entire kind of corner of the island, and charged a man who left quarantine at some point. And then, I was starting to sort of read about other places, including Canada, which is the other place that I'm from, where a woman was arrested for leaving her house when she was under quarantine. And again, there's no evidence of exposure, of doing anything dangerous, that she was even within 6 feet of people. She just stepped outside her house, probably because, as many of us who have been locked in houses for weeks now, she needed a breath of fresh air. She needed to look at a tree. She needed to do something, but with no intent of doing anyone any harm, but was arrested, and an officer is posted outside her door now. And so, which begs the question of what the officer will do if she tries to leave again, right? So I just started to see all that and be really alarmed at how all these orders that Kath was describing were going to be enforced, and looking around the world at different ways they're being enforced. So I started looking into the legal landscape and sort of trying to figure out who else was working in this field and what we were all doing. And that's what you'll see on the call, and where these slides come from. So what I discovered is that also there's a federal, sorry, you can go back to the last one, Hamid. There's a federal Public Health and Welfare Act that is different from the state of emergency legislation that Kath was talking about, that people started paying attention to recently because President Trump on Sunday started saying something about, basically locking down the entirety of New York, New Jersey, and Connecticut. And people started being like, well, can he do that? It turns out he can't, but he can, under this Federal Public Health and Welfare Act, regulate the movement of individuals between states, either who are suspected of living with COVID-19 or who are deemed to present a significant public health risk. So there is a way in which the federal government can engage in regulation across the country through the Public Health and Welfare Act without having to rely on any of those emergency powers. And states and local jurisdictions also have public health acts, which empower chief public health officers to enforce orders based on, by requiring individuals or the general public to either engage in certain activities or avoid certain activities. So it's actually a much broader power in some ways than police powers, right? Like now some jurisdictions are saying wear a mask or you'll get arrested, right? So they can tell you stay in your house or you'll get arrested, wear a mask or you'll get arrested, take a bath every day or you'll get arrested, don't take a bath I mean, it's really kind of, as long as they can issue some kind of public health justification for it, they can order you as a group or as an individual to do or not do certain things. Kath already went over the state emergency services legislation, and we've seen executive orders that are akin to the emergency states of emergency. And Kath also mentioned that, there's also plenty of laws out there that can and are being used by police of all kinds to regulate folks and police and punish and surveil folks who they believe are in violation of these public health orders. So in addition to the ones that Kath mentioned, there's attempted assault and assault, assault on a police officer, grievous bodily threat, reckless conduct, terrorism, and terroristic threat. And all of these have already been used. There is not to date, as there is legislation expressly criminalizing HIV transmission in this country, any laws that expressly criminalize COVID-19 transmission, but one was just passed in South Africa, so those do exist. So that's like another kind of layer to the legal landscape. And then I can go to the next slide, Hannah. And these laws, particularly the public health laws, can be enforced by a number of people, public health officers. The laws that Kath was talking about can be enforced by emergency services like FEMA or state FEMA people. They can also be enforced by surveillance and GPS tracking, and the US is looking to this, and many other countries have engaged in this, and I'll talk more about that in a second, but that's something particularly why I hopped on the LAPD, Stop LAPD Spying Coalition call on Tuesday and started, wanted to know how you all were thinking about it, because you all are the folks who I look to for guidance and sort of always being 10 steps ahead of the game on this issue of surveillance and tracking. Most of these things are being enforced through civil enforcement, but they're also being enforced through criminal law. And then, as Kath mentioned, the National Guard's being deployed, and one who was around during Hurricane Katrina, they can not just be deployed to provide medical supplies. And in Louisiana post-Katrina, they were deployed to enforce curfews, enforce police and criminal law, and engage in all kinds of violence. I haven't seen yet ICE officers. I mean, they're definitely continuing to carry out their raids. They're definitely continuing to do immigration enforcement. I haven't seen them do enforcement of public health orders or use that as a justification for putting someone into immigration proceedings, either a violation of a health order or something else, but I'm sure it's coming. So those are just some options. And you see, I was promoting your webinar in the other webinar. And if you go to the next slide. No, back one. So this is obviously not the best PowerPoint slide, but I just wanted to sort of share a few examples of what it's looking like now. So this piece about GPS tracking of cell phone data is happening primarily in other countries, but it can happen here. And either they're using cell phone data to track when people leave their homes, when they're supposed to be staying at home and they're violating a stay-at-home order, or when a person has been quarantined and they leave their home. They're also using it to track where people who have tested positive are going. And in South Korea, there's a map you can look at and see that, for instance, I don't know, in this corner of Prospect Park, or I guess Park where you all are, somebody who tested positive was there yesterday, so I'm going to go to this part of the park instead. But it also gives like the gender and the rough age of the person. Like it's not their name, but you could identify that. And if you got infected by being at that location and you have a sense of who you saw there, you could really fairly easily identify someone and start to attack them based on that. There's also apps in China that assign you a risk, and many people who are there, like, say it's assigned quite randomly, that then determine whether you can go into certain public spaces, on public transit, etc. We've seen some fairly drastic policing happening in China, both in-person policing and drone policing, and arrests for not wearing masks. And now there was a law enforcement officer in Texas, Laredo, I think yesterday, who said, if you go outside without a mask, you will be arrested in Laredo, Texas. So it's coming here very quickly. These civil summons, people are like, oh, it's just civil enforcement, it's just a ticket. But I mean, it's a lot of people getting a lot of tickets. And you just heard how many people filed for unemployment claims in this country in the last week. I mean, we're talking about finding people at $1,000 who didn't have enough money to make it if they missed a paycheck, right? Most people in the US don't have $500 for an emergency. And you're talking about hitting them with a fine of that or twice that for a police officer discretionarily deciding they violate one of these orders. They're using curfews in some places, particularly in Puerto Rico, where they're arresting folks for that, and also seizing people's cars for being outside at times when they're not supposed to be, which is affecting their ability to get supplies, get medical care, etc. We've seen pass systems and checkpoints in other countries. They're coming here. Maybe some folks saw that Rhode Island police were told to look for cars with New York plates and stop them from coming into the state. The ACLU challenged that, but Rhode Island is still going door to door looking for New Yorkers. Arrests of unhoused people. Sometimes, I mean, I've seen outside the Brooklyn Library in New York, 3 unhoused people have been living on those steps at least since I've been going for walks during this time, and they are social distancing. They are way far apart from each other, and they are wearing masks, and they are doing their best to stay warm and safe. If they were rounded up and put into a shelter tomorrow, they would not be able to do that. So that's happening in New York City. The sweeps are still happening. Sex workers who test positive have been arrested and charged. People who allegedly spit or cough at police officers have been arrested and charged, including a woman who called the police for help because there was someone in her house. She wanted them to leave. She didn't like their response. She was intoxicated. She moved towards a police officer, coughed in his face, and is currently sitting in jail. So she called someone because she was afraid of her safety, and is now in a jail where she's exposed to high risk of exposure, and charged with terroristic threats, assault, disorderly conduct, and is sitting in on a $50,000 bail right now in Pennsylvania, and won't even get a probable cause hearing until Monday. So these kinds of arrests are happening. A mega church pastor who held a church service in Florida was arrested recently. And then in what I'm concerned about in terms of like how this is playing out too, is that our tendency to support policing or engage policing or support surveillance and policing and punishment increases the more we are either upset about something like a police officer killing someone, or the more we don't like a certain group of people like sex offenders, quote unquote, or people who have been labeled as that. And the more fear we have. And this is a time where people around us are getting sick. People around us we love and care about are starting to die. We lost someone in the trans community in New York on Monday. People are going to start really blaming folks and getting angry and wanting someone to pay or be punished, or getting frustrated that they're complying with the orders and other people aren't. And in Canada, they've set up snitch lines across the country already where people are calling the cops, and they're encouraged to call the cops on others for non-compliance. And in some countries, there's even bounties set up for calling the cops and reporting someone who's tested positive, who's not reporting to the authorities. So the police are going to start to deploy us as part of their machine against themselves. And then, of course, there's physical violence by officers enforcing orders. And I just want to remind folks of the time at the height of the HIV epidemic, when ACT UP and other folks were protesting, and the police were really cracking heads during those protests, in large part because the police were scared. And the police were scared based on propaganda and false information about getting sick and being exposed and having to be there to interact with these people who they saw as contagious and deviant. And I think we're going to start seeing that here. We're already seeing that in India and other places. So, and here as well. Next and last slide. So I just also want to point out that none of this is new. And if you talk to disabled people and disability justice advocates, they'll say these public health laws were created to criminalize, surveil, police, cage, and contain us. And they always have been. And certainly that's been true for migrants too. And so certainly that's going to continue to happen, particularly because a lot of these orders, first of all, the information is coming at you fast, right? I don't know what I'm allowed to do today. Do I have to wear a mask to go outside or not? I haven't followed the press conference. And folks who can't follow that information for any number of reasons that might be related to ableism and disability and disablement are going to be criminalized for going outside, or if we can't comply because they have a condition that makes it such that they can't comply, they're going to be criminalized much more. Folks who are engaged in informal economies who can't stay inside because there's no income there are going to be criminalized. In New York, they've made liquor stores essential services because of the withdrawal that comes from alcoholism if you can't get alcohol. The same is true for many drugs that we use, both legal and criminalized. And so there's going to be a lot of criminalization of folks who are engaged in the drug trade, or folks who have to go to a methadone clinic every day still to get their treatment for being outside. Both essential workers who can't prove that, fast enough or to an officer's satisfaction that they're on their way to essential work. In New York, the police are posted at transit right now and demanding ID of everyone who goes in. And if they can't prove that they're an essential worker, they are harassing them or ticketing them or refusing them entry to public transit. Day laborers, informal caretakers, etc. And folks are also just talking about, oh, it's okay, they're only going to put those big fines on businesses, but which businesses, right? Like, which laundromat is like, well, I'm essential, I'm not essential, I don't know, maybe today I am, maybe I'm not, or the informal childcare, or the other kinds of businesses are going to be most likely targeted. Certainly other businesses that are already criminalized, like strip clubs and sex work venues. And then, you know, the usual groups who are being criminalized, whether it's under broken windows policing or criminalization of migration, are going to be criminalized again. And now, instead of just being framed as a sign of disorder, they're going to be framed as a sign of both disorder and disease, and amplified through both the combination of policing and public health. And the last thing I want to say is that we're trying to get a lot of folks released from prison, and we're trying to get a lot of folks not put in prison. And I think the trade-off that the courts and the criminal legal system are going to try and say is that you need then people to be on electronic monitoring. We need more probation, parole, supervision under those circumstances. And the problem is then you don't have the flexibility to go and get the supplies at the place where they are today, or to go to the store that has the thing you need. Or I had to go to 5 pharmacies to get medication I needed in Brooklyn because it was sold out everywhere. If I only have approval of my probation officer to go to 1, I'm screwed. And so people are violating and then getting sent back into jail because they're on these restrictive conditions that mean that they can't go get medical attention for themselves or an elder in their family when they need to, or go to the place that has the supplies they need. So I think, and also we want to think about how at this point people are being told to quarantine in their home, and sometimes forced to. There might not be enough food there. There might not be enough supplies there. It might be unsafe due to mold, due to other conditions, and it might be unsafe because there's an abuser there. And if someone leaves their place of quarantine because of any of those reasons, these criminalization pieces can come into play. Is there another slide there, Hamid, or am I done? Oh, the ACLU put out a guidance on law enforcement. I'll drop the link into the chat. This is just the key portions of it, but basically they're saying there should not be arrests under any circumstances to enforce these orders, and they shouldn't be fining people either because of the economic situation we're in. So I will be sure to drop that in the chat. Is there another slide, Hamid? These are the demands that were made by Communities Unite for Police Reform in New York City. I'll drop those in the chat, both around policing of homeless people and broken windows policing generally. And next one. Some cities have had some success in getting cops to stop enforcing certain kinds of offenses. It seems like Philly actually has the broadest scope. They're saying they're not arresting anyone for any drug offenses, sales, purchase, whatever, and also for things that are termed violent offenses like burglary or carjacking and fraud and bad checks and whatever. So that's a great broad stop of kind of stopping the flow into jails. But what they're doing is they're releasing people with a warrant that can be executed at any time in the future as conditions dictate. And that's now something hanging over someone's head and we know how warrant execution goes. It's never a good thing. So I'm a little concerned about the back end of that. Baltimore says it's not enforcing a bunch of things, but folks on the ground say they're still doing it. And other places they're defaulting to summons, but as I said earlier, that means you still have to come back and you still might have to pay a fine, you still might have to pay a criminal charge. That's the last one, or is there another one? Oh, there's a Know Your Rights thing that the Guild put out. Check it out. And Color of Change is setting up an infrastructure to mobilize around arrests as they happen. And we're just thinking about what instead of police, and that's the other part of the world that Kath was talking about, like how do we create the world that we want to live in, is how do we think through other ways that we could be supporting each other in working with these restrictions and these guidelines that will save lives and promote public health without policing and surveillance, and without turning ourselves into the policing and surveillance crew, right? And being the person who's like, oh, now I'm gonna go stand outside the door of all Asian people in my building and I'm just gonna stand there and make sure they don't come out. I mean, that's not a better than police, right? Like there's no criminal charge there, but the same, it's the same concept. So we've been trying to brainstorm some ideas around that. If you wanna be involved in that, some of the things we're thinking about is like, this is massive unemployment right now. Why don't cities just set up hotlines where people can call and say, I'm struggling with staying inside or complying because of this or that, or can I get some clarity about what I'm allowed to do or not do, and have people who have been laid off or can't work right now be paid to staff those lines, trained and paid to staff those lines. Could folks just be paid to call everyone they know and just check on them and say, how are you doing? Can you comply? No, I don't think going out to do your nails feels like an emergency. I had to have a friend the other day tell me, like, no, Andrea, you can't just run in and get one onion at the store. Like, find someone who's going out on a big shop and have them drop you one, contact free. Like this, and problem solving with each other and figuring out how we can deal with the inconveniences, or we can make videos of, like, your kids are climbing the walls, you're about to lose your mind. Here's 10 things you can do with your kids inside or that are safe in terms of complying with the orders that will hopefully save your sanity, right? So just coming up with ways that we can actually be in communication with each other and in community with each other that don't promote surveillance policing and so forth, and actually build relationships that we can then use to fight for the things we also need to stay at home, like rent strikes or cancellation of rent and full health care and universal income and all those other things. So that's it for me. If folks want to get involved in any of the projects I've talked about, whether it's tracking arrests and mobilizing around them, or thinking of other ways as a society that we can push to our legislators, push back on policing and say, no, don't put more money in cops around this. Pay us to support each other to stay home, or, pay a hotline or create a hotline, or just, other ways that we could support folks. That's it. And oh yeah, the last one is, this is a letter from public health and legal experts talking about paying people to stay home, which, so people know that it's not just Andrea's cockamamie idea. That's it. Thanks so much.
Great. Thank you. Thanks, Andrea. This was super helpful. Any questions, any comments? We do have a question then in the chat room as well. And I believe the question is that if we are going to be starting to document any of the, let me just look it up. Will there be a documentation that lists corona arrests? So that on that note, that the Stop LAPD Spying Coalition and the National Lawyers Guild, we're going to be filing a joint public records request. We're going to be working on that this coming weekend to the LAPD, and then going to be filing. And right now we're looking at their own records from previous arrests as well. So it's about, I think Kath was saying it's about 5 days old, so we need to get that current as well. But we'll definitely be filing in public records, and we'll let folks know. Kath, any other comment do you want to make on that, or?
Well, I mean, just looking at the recent arrests during the period of, safer at home, it's still pretty infuriating to see what some of the arrests are like, just in the past. So the last day we can see is the 28th, but the most recent days we can see, there are people who are literally arrested for violating park rules, blocking a sidewalk, trespass, a couple of quote unquote prostitution charges, loitering to commit prostitution. So very, low level offenses that are being, people are being arrested during a time when we're in the middle of a public health crisis. I know that also, I think John Raefling, I'm not sure if he's on the call, but I know that Human Rights Watch is also tracking some of the arrest data. So I don't know if he has any updates as well. I've looked through the data, but I haven't scanned it with a fine tooth comb yet. So I don't know. I haven't seen any arrests for shelter in place that have jumped out at me. I don't know if John, if you have.
I thought I saw John on there, but I don't see him in the list right now. But we can follow up with John on that. Yeah, definitely. Okay. And then there's also a question that I'm from Chicago.
I just answered, Jason.
Oh, you did? Okay.
Yeah.
Awesome.
So basically, we're trying to set up a national database. Center for American Progress is tracking kind of what's in the media. Color of Change is tracking what's in the media. And we're trying to figure out a national database that people can plug in, because not everything is going to be reported in the media and things that people are saying in their house. And we want to track it, not just for the sake of tracking it, but to also see if we can mobilize guild lawyers, public defenders, whatever folks to go and help defend folks either before or after. And then I see that Stevie is offering to do GIS. And
that's awesome. That's
it.
awesome.
It's amazing.
Great.
So we're going to make it happen.
Excellent. Excellent. So any other comments or questions to the stuff that both just really, really awesome presentations, Andrea and Kath? It was super helpful. Any other questions or comments? There's one that, do you know of any communities within the progressive movement who are doing their own tracking and epidemiology, in other words, making an effort to democratize science? We are actually working with the COVID-19 task force on race and equity, and just sort of like, in the process of doing some research and building some understanding as well. So hopefully we should be, it's just a matter of time, and that we should be putting something out. And then Jamie just made a comment that how in the community in New York is responding. So maybe, Andrea, that now we see James O'Neill
Oh my God.
back. I mean, all we need is to bring Bill Bratton and Daryl Gates back from the dead, and we'll have these policing experts. So if people don't know James O'Neill, he's a character. I mean, post 9/11, he was singularly responsible for a lot of MDC detentions in New York City and various other places. So any comment on that, Andrea?
Everyone's just spluttering. It's just, that's the thing too about all this, is it's like, it's coming at you fast, right? Like 1 minute, de Blasio's like, oh, the cops in New York will just be out there educating folks. They just have this nice little loudspeaker thing reminding people to be 6 feet apart. And like within 2 days, it's like, and now they're going to be aggressively enforcing. And if they don't do it aggressively enough, Cuomo's sending in like the state police. Like, it's just bananas. And this is de Blasio's choice. So I think I've sued O'Neill like, I don't know how many times. Anyway, so people are protesting. People are saying that it should be a public health person in charge of a public health problem, and really pushing back on this policing. But it's a little bit like a tank and juggernaut coming from Cuomo's office. I mean, you saw the budget he just passed. He cut Medicaid in the middle of a pandemic. He, is gutting everything, including bail reform, in the middle of a pandemic. So he's not, this is part of the force, and so is de Blasio. De Blasio has people at Rikers, which is the city jail, he's offering them $6 an hour and a chance to get personal protective equipment, which I'm not sure they can keep after, to dig mass graves, to dig their own mass graves at Rikers right now. So I think that it's clear that this militarized response is being very much adopted everywhere. And I'm just seeing someone in the chat, Jamie, talking about that healthcare professionals are supporting militarized response. I think it depends on who. There's a lot of healthcare professionals who have a sign-on letter to the mayor saying that they don't want a police criminalized response in New York.
Well, there was actually, and just to Jamie's point, there was actually a whole statement put out by it came out in the Journal of New England, Journal of Medicine. But before I go there, I just want to make sure that Jason, no, I was just joking about Gates. So there's no desire to bring Daryl Gates back. I was just saying that all we need with O'Neill is Bill Bratton and Daryl Gates back from the dead, and we're done. So, but one of the things that the New England Journal of Medicine has recommended amongst various recommendations is what they call a forceful focus campaign to crush the curve. And in that, they're saying that we have to establish a unified command. And now this is the Journal of Medicine that is recommending the president to appoint a commander who only reports to him. So not somebody who will coordinate the efforts, but just like a czar, just like a complete total control type of an appointment, which we see in other countries. I was just looking at Pakistan yesterday, and they have appointed like a lieutenant general from the military to be the commander of an intervention. So of course, like, this intervention. And then the Journal of Medicine goes on to say that the same power should be with each governor should appoint an individual state commander as well. So it's very
I think,
interesting. Go ahead.
I think it goes to what Bita was saying on Tuesday's call, which is that there's the push, and other people were saying on Tuesday's call, the push to enforce these orders violently, vehemently, and aggressively is coming actually from capital, which wants this economy back up and going because they don't, because capitalism is crashing, and by healthcare professionals who are feeling overwhelmed. And that was certainly what was driving the enforcement in Jamaica that I was talking about earlier, is that the health providers and the health professionals in Jamaica know that the island could not withstand a pandemic. There were like a few dozen ventilators. The public health system just could not withstand it. And that's why they went hard with the army and the aggressive enforcement and the closure of everything really quickly, because they just knew that they couldn't handle it. And I think that we're going to see more of an instinct, because usually health providers can be on our side, and we've been able to mobilize them on our side around policing and criminalization, and particularly in LA, you all were successful in doing that around the jail. But I think it's going to turn the other way if we're not able to come up with these other non-police ways of addressing these orders and these guidances, because they're going to say, look, at this point, there's no choice. People are dying and we're having to decide who dies. We can't have this anymore.
So I think a big pushback, because the question comes in that how are we then going after this narrative? Because the narrative has already been built under the War Powers Act, right? So the president should be taking the War Powers Act, and under the War Powers Act, you got to just like, the Defense Act and all of that, order these industries to manufacture more ventilators. So that's sort of like these moving parts of being at war is very much there. And just as Bita just made a comment as well, that absolutely, I mean, they're using that language. So their only response would be to crush this, because they're treating this pandemic as war. So that's exactly what's going to happen. I just wanted to quickly also just add a couple things as to what has been going around. So just today at 1 o'clock, we heard, and thank you, Carrie, for sharing that information, that private money is coming in, and John Rafling's and some of us, his favorite John and Laura Arnold Foundation, Andrea, favorite folks, they are now funding an initiative in Baltimore with the Persistent Surveillance Systems, which is a surveillance company, which folks in LA may remember that they had an airborne single-engine airplane over Compton for 8 weeks, 12 hours a day, surveilling the whole city of Compton for 12 hours a day. They did that. So now Arnold Foundation is teamed up with Persistent Surveillance, where they're going to just put airplanes in Baltimore to be doing private surveillance, and this is in partnership with Baltimore City Council. So that is very much going on already. This whole issue of unified command is absolutely now moving, and I think, Jamie, to your point, absolutely, I think this appointment of James O'Neill is very much a part of that. And I think we also see on an international level, just real quickly, we're seeing this coming down very hard. So Baton in India, people are being beaten up, they're being forced to roll around on the street. The migrant workers were sprayed with bleach and other disinfectants in a group setting as well. In South Africa, they were firing rubber bullets and storming buildings where people were there. In Philippines, they're putting people in dog cages and forcing them to sit in scorching sun as a punishment as well. In Mexico, in Yucatan, anybody with virus or symptom and they don't quarantine can get 3 years in prison. In Peru, it's a $600 fines for prank calling the hotline. In Hong Kong, you can face criminal charges if you violate quarantine orders, and failure can lead to an equivalent of $3,200 of US fine and jail up to 6 months. In Singapore, failure and for physical distancing or gathering of more than 10 people is a fine of $7,000 and 6 months in jail. And Australia, the police patrol in parks, etc., are giving penalties and 11,000 Australian dollars and 6 months in fine. So in jail. So I think it's sort of like moving in so many different directions. So the question is that what is our response? And I think what I want to do is to maybe just go back to Andrea real quick, but would encourage people to ask if just to share your comments. Please just let us know in the chat room if you want us to unmute you or just raise your hand. But Andrea, of course, you've done a lot of work, particularly around, you've written, you have a lot of scholarship, your own frontline organizing on police violence, particularly women of color and LGBTIQ communities of color as well. And so from your vantage point, how do you see this really playing out when it comes to enforcement? And we know it's coming. And of course, we saw how Broken Windows was basically built. I mean, one of the narratives of Broken Windows really going after some of the Black community about young Black women in tight skirts, leading to prostitution, low-level crime, blah blah blah. So I just wanted to get your thoughts on where we are with that, particularly the vulnerable populations.
Well, as I mentioned, in Paris, a sex worker was arrested because she tested positive for COVID-19. And, they did contact tracing and figured out who her clients had been, and, threatened to charge her based on each contact. Even though she didn't know she had COVID-19, she was asymptomatic. And, I think the thing about these transmission charges too is that, there's no guarantee that they're about actually having engaged in dangerous behavior, right? And I feel like that's particularly important with the surveillance and the GPS stuff, is that, they might say, oh, you were within, however close they can measure you with GPS, it's not that, they can't tell if you're 6 feet from someone. They can't tell, like, sure, I may be quarantined, I may have stepped out of my house, there might be no one for 20 feet around me, right? And I may have been wearing a mask and wiped everything down, but somehow the location would affect me. So similarly, in that case, it wasn't about transmission, it was just about discrimination, basically. Also, women, particularly Black women and Native women, are the people living with the highest levels of poverty in this country, and many are engaged in informal economies of all kinds, which are not being deemed essential and are not going to be also benefiting to the extent that anyone's benefiting from the stimulus package. So people are going to continue to engage in those criminalized economies and are going to continue to be policed under these orders for not being able to stay home, whether it's the unlicensed childcare, the unlicensed hair braiding, the the set up nail salon, whatever it is people are doing to, I saw people walking down the street selling incense yesterday. A lot of women are street vendors, immigrant women particularly, who often get busted under broken windows policing, are going to be trying to figure out how to continue to make a living in this moment, and will be targeted. Queer folks, as we wrote in Queer Injustice, have been framed as disease spreaders since the beginning of queerness. And certainly I think in this moment, gay men are being arrested for cruising, for having parties, for violating these orders. And just, I think generally that stereotype is unfortunately going to play out here. So I think those are some of the ways in which, and then the last thing I want to say is about DV survivors. A lot of these orders don't have an exception for if you're living in a home that's unsafe, and leaving that home because you're running for your life. Some of them do, like Wisconsin's do, and I think Massachusetts does as well. But also they're like, you can leave to go to a shelter, which is a congregate space, by the way, right? Or, you can, this public health order doesn't apply to survivors of domestic violence who are seeking safety, but no one's setting up hotel rooms for domestic violence survivors, right? They're setting them up for healthcare workers, but not for unhoused people and not for domestic violence survivors. So I think that domestic violence survivors who are either being accused by their abusers, and the abusers might be using these public health laws as a tool against them because abusers use every tool available to them, will contribute to criminalization of survivors, or survivors who are trapped in a home with an abuser and are doing whatever they have to do to defend themselves in that situation. And particularly if the abuser thinks that the person has given them something or has exposed them to something, is going to be tremendous and deadly forms of violence people are going to be defending themselves against. They're going to be criminalized for. And then I think people just trying to live, trying to survive, trying to leave when they have to. I mean, all the strategies we have to stay safe as survivors are disrupted right now because we're trapped at home and we're cut off from contact in a lot of ways. And we're also in a place where everyone's like, oh, well, we're staying connected through Zoom and through text and whatever. It's like, but you're now in the home with your abuser who can see all of those things. Mm-hmm. So you can't access the same kinds of things that you might if you were like, oh, let me just go to the church to, drop off our offering for this week, or to do my Bible service or whatever, where you might get some support and help while you're there. You can't do that anymore. Church is online and your abuser's watching you. So I think that's going to lead to a lot of gender-based criminalization for queer and trans people and youth who are experiencing homophobic violence at home, and for and for survivors of abuse who are going to be criminalized many ways.
Mm-hmm. So, and Jason had a follow-up question on that. Is there articles of this about transmission charges, and also are there organizations we can work with nationally or locally to fight against transmission laws?
Yes, so HIV Justice Network put out a statement based on criminalization of HIV that is working not only nationally but internationally, and they're also tracking arrests internationally. So I'll drop that in the statement in the chat box, and they're organizing folks and folks like Kenyon Farrow, who's been who's at the body now, but who's been organizing around criminalization of HIV for a long time, is building networks around that, particularly around Black gay men. I think he's doing a webinar right now. Yeah, I think those are the folks who are most ahead of this, because they're like, oh, we've seen this story before, and are already trying to bust back.
So I think what we'll do is, I just want to have one more question with Kath, but we will just, since we're just going to go and in about a couple of minutes unmute everybody. But yesterday, on Tuesday when we tried, people were on unmute, and it just became a whole lot of background noise. So if folks can monitor their background noise. But what I wanted to ask Kath was that, Kath, in your survey and looking at the landscape, what we have seen in the past, and this is something for the coalition, like we work in this context of not a moment in time, but a continuation of history, that how past crises, both real and concocted, led to the expansion not only of police powers, but tactical operations as well. And for example, 1984 Olympics, we saw two things really just go and become a permanent piece. One was the development of gang injunctions and gang databases, which in 1982 there was talk, but by 1987 they had formally started unleashing gang injunctions and gang databases. And then what we also saw was the development of right around that time of Operation Hammer, which came as a result of, with the war on drugs, as a result of the massive military equipment that the LAPD has received. So in your just doing a check as these things are moving, do you see anything in that, and should we be monitoring that, and if so, what?
Well, that's a great question. So when we've been out there, one thing we've noticed is that, so LAPD, I think, at least in the very, very limited context of protests, has been, someone called it potty trained, and I like that. Potty trained by some civil rights lawyers here who've sued many times, including but not limited to Carol Sobel. And so we see, I think the tactic that LAPD uses most often now with progressive protest is kind of like a hands-off, wait it out, because what they've realized is that, people run out of chance eventually, people run out of energy, people have a job to get to, and so if they wait it out, that seems to be the approach that we saw, and we've seen in the past couple of years. That's what they go to. And they've done it somewhat effectively. Like I've actually seen them break up arrests using that tactic. They've been completely prepared to make an arrest. They'll have, squad cars out there. I've seen 15 squad cars out there, flex cuffs, 40 officers. They're prepared to make an arrest, but they talk to the property owner and they tell the property owner, hey, let's just kind of wait this thing out, see how they do. And then the protesters ended up, feeling like their objectives were achieved because they got on the news, and then they all went home. And so, certainly that's better than beating people up and brutalizing people. And the reason they've made that switch is because they've been sued a number of times by civil rights lawyers, for doing just that. That is not the case in neighboring jurisdictions. So Torrance is one that we need to keep an eye on, just kind of collectively. We've had legal observers, including someone on this call, Stephen Raginald is one of our legal observers. And we've had legal observers out most every week up until COVID-19 at the Torrance City Council meetings, which are very militarized. Black Lives Matter has been protesting every week at City Council to protest the murder of Christopher DeAndre Mitchell, a young Black man who was murdered by Torrance police. And that protest has resulted in city council meetings being shut down with 40 riot gear police, activists being beat up. So there's this, some civil suits in the works. NLG arranged for criminal defense for folks, and we've had legal observers out there for the past year. But Torrance is definitely a police force we need to keep an eye on, and they definitely need some lawsuits coming their way. What's been done with LAPD, I mean, we continue to keep an eye, and there are a number of things that we have noted over the past couple of years that we need to watch with LAPD, but the neighboring police forces, and then when you talk about Orange County or the Inland Empire, it's just the Wild West. So we need more accountability. We need more eyes on the police, especially, where we don't have as many progressive activists and legal observers like
one of the
East.
Yeah, and I think one of the things for the coalition, this is a discussion that we've had, where we will be we're actually in the process of putting stuff together. Of course, one is with the arrest data and everything else, along with the guild. But the other public records request that we are looking to file with the LAPD is really go back to the basics and have a very comprehensive public records request, anywhere from a record of all their communications with the intra-agency and intra-agency, and with FEMA, with Homeland Security and various other things. Anything moving in the direction of material acquisition through the 1033 program, because then these are the things, because of course this whole surveillance apparatus is going to become permanent. We know that as through various forms of tracking, but then how it becomes more tactical also for us to learn, I think that'll be something that we're going to have to keep an eye on. So with that, I think we are going to unmute everybody, and people can mute themselves.
Can I just say one more thing before we go there?
Yes.
Is that you had asked me about sort of how gender and COVID-19 enforcement would intersect. And one thing I forgot to mention is that states are using this to criminalize abortion as a non-essential medical service.
Like, I'm relaxing at home.
Okay, well, we have
Sorry. So the some states like Texas and Ohio and West Virginia and other places have declared abortions elective procedures and therefore criminalize them in this moment under public health orders. And so there's a platform there on reproductive justice and COVID-19, and also giving people access to self-managed abortion in this moment. Because even if they weren't criminalizing it as elective procedure, some folks might choose to not go to a clinic to get a procedure right now. And the other is the foster system, is that, there's a lot of things you have to comply with when a foster care case is opened against you as a parent, and that tends to be predominantly Black moms. And if you can't comply with them now and the public health orders, then you risk losing your children. And so Movement for Family Power is documenting impacts of COVID-19 on the foster system. So those are two other places of criminalization I didn't mention. And then I just dropped a couple more resources there around disability justice and COVID-19, and the Movement for Black Lives for the COVID-19 platform that folks should check out. Sorry.
And they're all here. No, thank you so much. Should we try unmuting all again? A lot of noise in the background. Okay. Well, okay. So we've unmuted everybody. So if people want to make comment, please feel free. You'll have to unmute yourself.
Oh yeah, I have one comment.
Okay, please go ahead.
Yeah. So, well, my name's Kelly. I'm a CSUN student. My question is, how do we make these Zoom meetings accessible to deaf communities? Because I want to share this information to my deaf friends. I've been trying to share the teachings that have been happening around, but it's hard to find captioned videos or having interpreters present during the Zoom meetings. So I was wondering if anyone knows where I can just easily request an interpreter that's not expensive to be present during these meetings.
Anybody wants to answer that? I know there are folks in the community, Kelly, who do that around language justice. and things like that. So that's one way to reach out to folks, depending what sort of translation or interpretation are you looking for, which language. And then as far as these are concerned, we have been recording it, and then we're going to be uploading these on our website. So they will be available hopefully by next week. And then if you want to use them, please feel free. But
The problem is that if they're not captioned, if they're not captioned or there's no CART language, then it doesn't help folks who are deaf. So
yeah, absolutely.
We need to figure out how to transcribe or do something.
Somebody was going to.
I was just going to say, sometimes at our meetings, what we've done is we'll have these headsets. They're not that expensive, but that's for an in-person meeting, right? So you have like one person who's assigned to do the translation and speak into the headsets, and then everyone listens to it. But maybe for a Zoom meeting, what we could do is like have a different call-in number if you want to listen to it in Spanish, and then have a volunteer sign up to do the interpretation. It would be simultaneous interpretation. So that person would be on mute on the Zoom call, and then they could speak into the cell phone, and then whoever wants that interpretation could call into the cell phone number to get the Spanish translated version. So maybe like that could be a way that we could get creative and like think of simultaneous interpretation on Zoom, because we do it for in person, but I haven't done it for Zoom yet. So that's a great question, Kelly.
Yeah, thank you, Kelly. I think definitely something that needs to be working on. So yeah, okay. Any other questions? Chella, do you want to make a comment? You may be on mute. Okay.
Sorry about that. Hey.
Hey.
So I'm gonna be honest. As soon as I got on, my phone died. So I had to like reconfigure it and come back in like 40 something minutes. But like the information that was shared was really dope. Not dope, but educational. I'm really scared for sex workers in LA. And so like knowing that there's already been arrests in the East Coast with sex workers and they're being charged with what was I'm sorry, who was the person that was talking about sex work?
It was me. It was me, Andrea Chela. Hey, how you doing?
Hey.
It was actually in Paris, so it's not in the U.S.
Oh, in Paris. Okay, good.
But you know, it's a matter of time, right? So I'm worried about sex workers and drug users too, and I'm worried about overdose, and I'm worried about folks not being around to do naloxone. I'm just worried about all of it, and I think the only way we're going to be able to deal with it is one, to set up mutual aid funds for people in the sex trade, which we've done in DC and New York, and have other people donate their stimulus to that, for instance, or whatever we're getting, $1,200, whatever the fuck. So that's one option, just to help people survive without trading, and then also support people in doing remote sex work, right? I mean, not all of us are great at being cam girls, but whatevs, right? Like if we get people cameras or whatever equipment they need to set up that way, or some other way. And then I think, we're just going to fight like hell against these transmission laws, because they will, as HIV transmission laws and criminalization laws are used against people in the sex trade. In fact, in some states, if you trade sex and you're HIV positive, and again, they don't care if you used a condom, they don't care if you did something that was completely safe and has a zero chance of transmission, they don't care if your viral load is zero, they just care that you're HIV positive and you trade sex. Not only are you criminalized and there's a higher penalty, but then you have to register as a sex offender, which of course is going to aggravate the situation where you were trying to meet your needs, your financial needs through the sex trade, because now whatever. So you're blocked out of everything else. So I think we really need to aggressively kind of support and intentionally support people in the sex trade in every possible way in this moment, to prevent those kinds of things from happening. And I think we need to also just be aggressive about the needs of people in the drug trade and other informal economies.
Oh my God.
Look, people are going to need drugs in the same way that they need a glass of wine, and we can't have people being thrown in jail and sentenced to risking death because they had to go score. And we're going to figure out to organize medical professionals around that. We're going to have to figure out something. So, and let me just say, Chela, you being on reminded me of our conversation last week about Cop Watch, and Kath mentioned that. I think one of the things that Kath was talking about in LA was setting up tip lines, and I would just encourage those of us who do Cop Watch in other cities to not kind of give up because we're all inside, right? Like, people are going to the grocery stores. Can we put a sign up at the grocery store saying, are you harassed or arrested for something, for violating a public health order? Call this number. And that we have people staffing those, and that we're paying people to do that. There's a lot of emergency funds out right now from foundations. Let's put them to use to try and support folks in the situation.
All right, great. Thank you. So we have a couple questions, but before I go there, I know Jasmine, thank you for raising that in the past we've had a note taker on a Google Doc. That's in continuing note taking, but unfortunately we didn't manage that. But we have the recording, so I guess once the recording is up, we'll be able to get that information from there. But thank you for highlighting that. If folks can be unmuting themselves. So we have a question from Jason and then from Sarah. Jason, go ahead.
Yeah, just again, I'm not sure you answered this directly, but is there a way to then collaborate with you, Andrea, and like the guild folks, just in terms of creating this database? Because I've been collecting stuff on my own and just like
great. No, just hit me up. I'll drop my email in here, and I'll put you in the group of folks who are trying to figure out how to make this national thing go.
That'd be great. Like, her and for us, it's stoplapdspying@gmail.com. So feel free. Sarah, did you have a question?
Yeah. Just wondering how, like, any suggestions how, like, the average quarantined person who's like that's particularly susceptible to, like, immune wise to contracting the disease, so can't really go out and do too much, but I'm interested in supporting, like, how can people support pushing for funds to go towards, like, something like a hotline to help for compliance rather than more policing. So just wondering, like, how can the average person get involved and, like, really push for that, rather than see it go the other way.
I think people can really call there and tweet at and generally harass in all the ways, but I think calls in this moment really work. They're policymakers, they're legislators, they're mayors, decision makers, council members, I guess in your place, superintendents, because at this point, the people who are calling them are the people who are calling for more police, right? The people who are freaking out. And then, so I think that the more you can give legislators ideas of other ways of doing this and get your friends to call them and really push back and say, there's just no need to spend more money on police rounding up homeless people when you could just spend that money on hotel rooms. Like, let's just cut the chase, like, cut it and everyone's safer. The police are vectors of disease. They're giving it to people as they go out, and the police, if you want to make a police are safer argument, you can too. But I think really making these phone calls and tweeting at people and emailing them and just bombarding them from every angle and getting as many people to do that as possible, so they're hearing something other than, we got to get ahead of this, from the healthcare providers, the business owners, the people who are suffering, and saying, let's just get this over with, just clamp down, just arrest everyone. They need to hear from other people that there's other ways that are actually going to be more effective and cheaper and less police focused.
Is there like a what's it called, like a script that might be available for making those phone calls and writing those emails? And
we can try and come up with one and share them out. Thank you.
No, there's actually a script already. I think Shakir, I don't know if you want to talk to that. I saw something that Justice LA or somebody else had put out for like a phone script to make phone calls to judges and all.
Yeah, Justice LA is doing a number of scripts related to releasing people from jails and decarcerating. The biggest obstacle at this point has been judges. Prosecutors are obstacle too always, but they've been really kind of holding it up and refusing to do it. So Justice LA has some resources you can find on their social media, and I can try to post it here too. how to put pressure on judges to release people.
So Sarah, if you want to send us an email that's listed stoplpdspying@gmail.com, we can always send you back that script as well that they had created.
Okay, yeah, definitely. Yeah, a script, and then also just more information so that, like, you know, I'm more educated about what is actually out there in terms of just suggestions for alternatives. Because, you know, me, like an average person, not involved with any of this at all. It just all seems like really ethereal and like too good to be true. That'll never happen. So seeing it in writing, having a script, and then maybe also doing something like a social media challenge, like those challenges we've been seeing on social media. And so rather than, you know, whatever else that's been, you know, call your rep and, you know, read the script, and I challenge 5 people and maybe spread it around that way.
Thank you.
Those are great ideas. Thank you so much for those. We're going to get on those right away.
Yeah, thanks. Jamie, you're on Stack next.
Yeah, thanks. This has been really great. So I'm just wondering, as far as next steps, just looking at, you know, New York has been, unfortunately, in some ways, an example to us as to how this is all unfolding in front of our eyes. And I was wondering if, you know, in regards to what we're doing in LA and trying to get ahead of this kind of militarized response, how do folks, I guess, start to think about how we organize to make sure that similar things like appointing an ex, you know, NYPD commissioner, where we would see an ex, you know, LAPD chief come in and kind of take charge of how, and the most interesting thing about this commissioner business is that he's in charge of distributing resources to hospitals. So not only just in charge of kind of, you know, the ticketing and the, you know, enforcing stay at home, but also being able to determine how places are going to get resources. I'm just wondering if we can imagine in LA and thinking of next steps of what we do to prevent this from happening. And if, like, in some ways I also think, like, is it even good to kind of bring it up, you know, to give them an idea that this, you know, this is an option for them, or how do we start to organize ourselves to reject this and to kind of also use this as an example to reject this militarized response. So I'm just wondering if there's any, like, suggestions to us, like based on what folks are now doing in New York, but that we can try to get ahead of that and kind of blow up that this is not the response we want. And we don't agree with healthcare professionals that are encouraging a militarized response and use LAPD as like kind of this, and especially being at the police commissions, using it as like this platform to kind of say, like, we reject this response. But I was just wondering if, as next steps, what would be something that we could do, I think, besides the obviously kind of going out with that demand, but what else we could do, and what are folks doing in New York to try to, you know, attempt to reverse it, to disempower, to, you know, shift that narrative, like we've been talking about.
I mean, I think you all have so many relationships with public health folks from your jail fight. If you could identify someone among that group that you think should be your COVID response task force chair or czar, for lack of a better word, start pushing them. Start saying, we want this person to be running the LA response to COVID-19. And it's someone who's like not going to go with this approach, right? And really start pushing. I think we were, to be honest, caught flat-footed. We didn't know they were going to appoint, that de Blasio was going to appoint a task force person. If we had known, we would have come with would have come harder with like a public health person should be in charge. I think we just assumed that that would be the case if something like that happened. I mean, even Trump has like Fauci in charge with whatever, right? And so we were just like, I'm sorry, what now? Like, and we were caught. So if you can think of someone or start talking about the characteristics of a person that you think should be leading LA's response, then start pushing them now.
I mean, one thing that is a silver lining in this, and we have a model right now in front of us, is how the County Board of Supervisors removed the sheriff as the head of the Emergency Operations Center. I mean, the sheriff, LA Sheriff's, has always been as the head of who leads the charge for the Emergency Operations Center. So now they have a cop that they removed based upon the failure, and they go back. And of course, there's a lot of power play involved. So we can definitely point to that as, like, you know, that we see that this is not the job of a police, of a cop. do that. This is the job of somebody who is an expert. I think that's one. The second one also is that fuck the czars, that we just don't want to have just one person, and our fight should be, because we, just as Andrea was saying, with Beta as a co-chair of the COVID-19 task force on race and equity, I think we should be lifting those sort of bodies which are very much rooted in the community, as to be kind of just pushing and doing the broad-based community outreach and community education. So I think that's a great question, but I think there's definitely, we have an opportunity here, Jamie, to sort of map out that what our response is going to be, and it's coming from the bottom up, from the community, than anything else. But thank you. Anybody else has any comments? If not, so what I wanted to do was to, that just as a resource, to let folks know that this is something that we have, this is a zine that was developed right here. So it just basically goes through a bunch of things, and it's a it's going to be, it's already uploaded on the website, so folks can download that. It looks at this whole issue through the lens of, and this is done in partnership with Baby Anarchist and Palestinian Youth Movement in LA, and looks at this whole issue of not a moment in time, but a continuation of history, and for us to really be building power and not paranoia. So it answers baseline questions, and of course, like, also challenges some of the myths and facts that are being floated around as well. Also sort of like, how we are using our language, that instead of social distancing, using the language of physical distancing. So, we still want to build socially in various different ways. Then just and then talking about that, where our fight is, that about housing, about the impact on the unhoused community. And this is also going to be, now this is done, so it's going to be printed and it's going to be distributed to our communities as well. It has looking at that, where our fight is. So it's a pretty thorough, goes into the history of what we were talking about around the national security police state, that how previous crises, both real and concocted, impacted. And this is what we were talking about earlier, the expansion of police powers, what we saw out of the Safe Streets Act in '68, after the 1984 Olympics, the 1994 crime bill with this concocted crisis of super predators and gangs and meth epidemic, looking at 9/11, the Oklahoma City bombing, and on and on and on. And then there's a whole set of resources and guides that are also been, and just knowing our fight, where our fight is, how do we speak about this to each other, what are some of the basic suggestions. There's a whole series of resources for food and housing that are listed over here as well. Free online activities for children, mutual aid, free and low-cost internet, particularly for the schools where, there are so many, 64 or so different resource center for LAUSD for grab and go, and for the food availability as well. And then LA Can has come up with this really badass, hand washing, how to develop your own hand washing kit, do-it-yourself hand washing station. And so they also have a map of where they have been placed very strategically in Skid Row, where people can go for do the hand washing. So it's there, folks. And then their LA Can's information, and this is just awesome graphics from Baby Anarchist. So really happy to see this come through. This was a collective effort, and I would suggest that that if you go to the website, it's the Stop LAPD Spying. It's posted right there on our banner. So if you open the first window, it's gonna show up. So feel free to download that and share extensively. And this is going to be a series, so we're looking for folks for feedback as well, that as we continue building on this series as well. So yeah. And hopefully we should be able to get it translated in Spanish in the next week or so. So we will upload the Spanish version of this too. So any other questions and comments from folks? Okay. Shakir, do you have anything to add?
No, just Hamid kind of said this, but so the zine it's sort of meant to be part of a series, and this is just issue 1. So
This
as
is
we're
issue 1.
yeah, so and for the future, if you want to make contributions, like if you want to write something or send in photos or whatever, that's something we want to be able to include stuff people submit. So it's stopmypeacebuying@gmail.com if you want to contribute to the next couple issues.
And then what we also wanted to do with the continuation of this webinar series as well is to really just have this, do this hopefully a couple times a week. If not, then definitely once a week, every Tuesday, that's our meeting. And we want to turn this into a community participatory, because these were just like, these 2 webinars were more like looking at a bird's eye view about police, state, and community health. But we also want to now go into our communities and have folks from different sectors in the county and in the city as doing a report back as to what are we seeing in our communities, what are we seeing in South Central, what are we seeing on the east side, what are we seeing just on the west side, what are we seeing, both in the context of policing and, how are the communities dealing and handling with that? Because I think one of the things that is very clear, particularly for some of us who have seen martial laws and curfews and things like that, that the first thing that is done is, of course, those were in the pre-internet days, is a complete sectioning off of communities, that you don't even know that what is happening in a community 2 blocks from where you are, right? So that people can't even talk to each other. Phone lines are immediately sealed off, so you can't even communicate. We've seen how in various countries, both the internet gets dropped and social media gets controlled as well. So, not to say that, and not to start some paranoia over here, we are building power, but things just to be prepared for that. So I think, in a sense, what are the ways that we can, at least up to a certain point, stay connected and be socially connected with each other and into each other's communities as well. So any suggestions about that from folks, that how we can craft that? And maybe I'm proposing we do it this coming Tuesday, as what could be a potential report back look like from each community. And it could be 6 or 7 different folks who want to volunteer, and maybe like a 5 or 7 minute report back. That's a question to everybody, including Long Beach and other places too.
And related to that, if there's topics that people feel like would be good to address next week or another meeting, either there's just something you want to hear about or learn about, or something you want to present about, and you want that kind of on the agenda, it's a good time to volunteer.
I mean, I can propose something. Next Tuesday is the first Tuesday of the month. Our conversations are typically the intersection of surveillance, gender, and sexuality. And I was going to see, I saw West was also from Swap LA, was on the webinar as well. And then maybe Chela, not to put you on the spot, just wondering that if that is something that we can coordinate, as to a coming back as to both that how are folks sort of navigating the crisis, how are folks surviving, and what do they see out there in the communities. So particularly, as you were saying, Chela, about the vulnerabilities of sex workers, but also Black trans women and the trans community as well. So it's a question, Chela, and just wanted to see what you think. Oh, Chela says, yes, I'm down. Okay. And
okay, yes, I was, yes, I'm totally down. I can also hit up Wes, see if they would also be down to be in this convo. And
okay.
Yeah.
And maybe what I can suggest is, Chela, that we should try to reach out to someone from the Trans Familia, community and to see, like, particularly how is it this issue is impacting the trans undocumented community as well.
Yes,
Um,
definitely.
and I know because a lot of times, just the status of being undocumented and immigration status sort of gets, we don't do a deep dive into that. So I think we should be doing that. So I think that could be one topic of discussion. We can do a deep dive and just to learn and then have a conversation as to what that it looks like. And then maybe, Jasmine, at some point, it'll be great to have folks, maybe another webinar could be committed to just focusing on the overall immigrant community, and particularly immigrant youth and other communities, like how is that, what is being felt in that, and what is the response, and how are people organizing, and how are people navigating this system. I think you're on mute. So, okay.
Okay, yeah, that sounds good.
Okay.
Yeah.
Mhm. So, and then maybe we could, you can identify some of the folks who you would like to partner with, and we can have a similar conversation or presentation, and it could also be very much done in the context of both history and current practices as well. Yeah, so that could be going on. So I think these are just some of the themes that come up, and if people are interested in that report back, just from different communities, please email us at stoplapdspying@gmail.com, because we would love to organize the whole conversation around that as to how people are dealing with that. So yeah, so maybe then for folks who are on this call, so we have a confirmation for next Tuesday at 6 o'clock, where our webinar is going to be on the impact on looking at this intersection of surveillance, gender and sexuality, the impact on QT-POC community and sex workers. So we will have Chela, and Chela, would you reach out to Geneset or Mariela? Or we can follow up offline. So, okay. All right, so that's that. So yeah, please. Oh, I thought somebody was going to make a comment. Okay, so any last comments from Kath or Andrea and Shakir before we wrap this up? Any thoughts?
I just want to thank everybody. I mean, this was good for my heart, just being here with you all and hearing everything everyone had to say. And I think a lot of the same kind of things that the Guild has been saying for a long time about knowing your rights and, not talking to cops and, understanding what those frameworks are is going to be just as important now as it is ever. So reach out to us anytime. And yeah, just glad to know you all and work alongside you.
Thanks.
Same. I'm just feel really blessed to be able to be in conversation with LA family, saying hi to all of you out there who I know, and for us to be strategizing coast to coast on this on multiple fronts feels really powerful. So thank you for having me, Hamid. I appreciate you.
Of course. And Shakir?
No, I have nothing to add. Just thanks everyone for joining. And yeah, this is, I think, a moment when it's, in a ways, there's so much that we're not prepared for about what's coming, but I feel like we're also, very prepared, and just the fact that we're trying to here together and draw on our organizing and power building from the past and trying to go into the future with that. That's how we prepare for what comes next.
Great, thank you. And before we close up, there's a question from Sarah to everyone. Sarah, go ahead. You may want to unmute yourself.
Hi. Yeah, no, just the question about staying connected, that you put up, not from a place of paranoia, but just like learning from the past and with the potential of, martial law and cutting off communities, and social media has been like such a lifesaver. So I would love to keep up with that conversation. I feel like it's a really big question and I don't have any answers off the top of my head, but would just to, love to keep up with that. And I don't know if there's a way like to keep up with that. Maybe an email us or something. But yeah, that's all I was saying.
Great. Well, thank you. Well, thank you all, folks. Thank you very much for hanging in there. And this was awesome. This was wonderful. This was recorded, and hopefully that should be uploaded on our website in the next days. Look at the zine that is also on the website. We will also try to get all the information and get that uploaded too. So have a safe night. Be healthy and safe, and look forward to chatting with everybody next Tuesday at 6 o'clock, and look out for the Zoom details. And thank you again, Andrea. Again, I know it's late in New York, so thanks for
Definitely
staying.
past my bedtime. Thanks.
Yes.
Bye, y'all.
Thanks. Bye. You take care.
Bye, everyone.
Bye-bye. Bye.